Ia.
Ngā uaratanga o te manatū hauora, ko te manaakitanga, ko te kaitiakitanga, ko te whakapono, ko te kōkiri ngātahi, kia tai atu tātou, ki pai tata, ki pai tawhiti, ki pai ora. Kia tūturu, ka whakamaua, kia tīna, tīna.
Tina.
Hauye, huie, taiki.
Yeah.
And of course, the beautiful translation there is let us jointly pursue the values of, in this case, written by Te Manatū Hauora. So we'll give them reference to that, Ministry of Health. But of course, let us just jointly pursue the values. We take care of each other. We create an environment for our people to thrive. We work in good faith and we move forward together. If we do this, we'll lay hold of distant horizons and those near to us, and we will create a thriving future for all people. Great start to a session, I reckon. Ka pai, alrighty. So, first of all, ka hoatu te rākau ki a koe, Maria, ki te tuku te whakawhanaungatanga ne.
Tēnei tātou katoa. To those of you who were here in the previous session, he mihi nui anō. Ko putau aki te maunga o hine mataro te awa, ko Ngāti Awa te iwi, ko Patuai te hapu, ko Maria Clark taku ingoa. I am a member of Te Paerewa, responsible for a lot of the implementation of te Tiriti and principles and values of Paiora. And my other portai is I'm the Home and Community and ACC Service Coordinator for Te Punaora o Mātātua, and we sit in the lovely Bay of Plenty in Whakatane. No mai hara mai, kia ora tātou.
Kia ora, Jade, would you like to introduce yourself?
Kia ora, Rihanna. Kia ora anō to those who are joining from the previous session. Ko Jade Taku Ingoa. I'm Principal Advisor here within Manatū Hauora and providing support for our Te Paerewa members, Rihanna and Maria, today as they discuss the updated Tiriti requirements from an auditing perspective now. And I'll hand it back to you. Kia ora.
Kia ora, Jade. And tēnā koutou katoa anō, ko Rihanna Manuel tōku ingoa no pare hauraki a hau, I tipu ake au ki te taha o ku maunga, o ku awa me te moana o tikapa, kei roto I taku ukai po ko te awa o Manaia. Kia ora whānau, I hail from a little place called Manaia, which is on the Coromandel Peninsula. As you can all appreciate, we've been fairly freaked out most recently by a wonderful wonderful person who came in completely unknowingly with the Delta variant. And so we've been pretty busy down here, which is why I'm hoping you can't see, but I'm sitting in a van just outside our swabbing station because that's my other day job at the minute. And I've kind of tried to put a bit of a background so that it doesn't look so obvious. But it's my pleasure to be here as the chair of Te Āpārangi. I also am the Chief Executive for Te Korowai Hauora Hauraki, who are an NGO Māori provider here in the Coromandel Peninsula. Also am the Chief Executive Officer for Hauraki PHO and own a rest home and hospital, a very small one. So those are the perspectives I bring with me today, and it's a warm welcome to you all. Alrighty. So just some housekeeping again. We're recording the session. And all sessions will be made available on the Health Cert page on Ministry of website. We will be publishing these slides on our website, and we will also be managing questions. So how we're going to manage those is if you could submit your questions through the presentation via a chat function. We will be accepting questions from now for a little while, and then we are going to endeavour to answer those inside this session. But if we can't answer all the questions or respond to people's feedback, then we'll do so afterwards and make that feedback available. So, because I'm just mindful in the last session, yeah, we didn't have a lot of time left over, so we'll try and either be faster or we will make sure that we get you that feedback anyway. So please ask questions. And as I said, if we can turn your videos off, it just helps the whole presentation go a little smoother. So why do we find ourselves here? Of course, we did the review of New Zealand sector standards, which began in 2019 by Recollect, so before COVID, of course, and somewhat during. And of course, Te Paerewa, we're a group that were set up, or if you like, an advisory group set up to offer support, as many committees were around the sector guidance standards. We feel really privileged to be given the opportunity to talk to everybody today, to probably try and put some context about what we were all thinking, and also give some guidance and some good tips and tricks that can be used to help you know, navigate our way through these. Sorry. So as I said, the backstory to this was early 2019. Attendees to standards review scoping workshops, we confirmed that what we wanted to do in terms of an approach. One was to update the current standard recognition of Māori values and beliefs, and the second was to add Te Tiriti guidance throughout the entire standard as it related to the various areas. So that was kind of the motivation or the backstory, if you like. The DAA handbook is currently being reviewed, but the intent of the principles and code of conduct remains the same. So again, that's just a bit of information as we move forward. So our group Te Paerewa were established to direct this work of reviewing a number of criterion, and of course section 1.1, which is pai ora, the 34 Te Tiriti or Waitangi statements throughout Ngā Paerewa, a number of criteria throughout the documents, and the presentation we're hoping today is to understand why, what we hope everybody achieves out of this is to understand why some of these criteria needed to be reviewed and how they could be brought to life or evidenced. And of course, this morning we did a presentation to our providers. I'm really aware now that we are talking to our auditing whānau. So of course it's a different lens, but with some similar tips and tricks, because often as auditors, and I myself am a trained auditor as well, we often try to give support to our providers on how they can improve or evidence something. So hopefully this will give some information about that as well. Now, Maria and I tend to tag team in this whānau, so if you missed the morning session, now we go into the matinee session, and of course you'll get a similar version of tag teaming. Ka pai. Oh, sorry. Okay, so the 2008 standard is outcome focused. So, sorry, Jade, you got something to add there? Have I missed a slide? Okay, ka pai. As part of, and we've just highlighted here, as part of the interpretation of these standards and the outcomes they describe, the context for service provision must be considered. This context includes both the specific needs of the individual and the overarching aim to support well-being and quality of life. So when it came to, you're responsible obviously with determining whether this outcome has been achieved, that it is appropriate to the context of service provision. And we've just highlighted down the bottom there, for example, to achieve the outcome of the criteria, services would need to demonstrate their communications were appropriate to their particular audiences. And children's services, this could include providing information at an age-appropriate manner, as such as through storybooks. When services are for Māori, this could include information and resources in Te Reo Māori as well as Te Reo Pākehā, Te Reo English. Hello. Okay. The 2020 one standard, so just in comparison, is also outcome focused. So again, each service provider is unique, specific interpretation, application and contextualization in each environment is required relative to the provider's size, setting, complexity, risks associated with the service provision and population being served. And it's important, when we talked this morning, we really wanted to give a flavour of what it was to be a provider who is very small. And Maria and I tried to canvass that for many of the providers to acknowledge that some are really big and have lots of resources, some are very small and will have limited access and resources. So the example here in this example is throughout the document there is reference to a governance body, and smaller providers that do not have a governance body, for example single owner operators, providers shall instead show that a meaningful approach to decision making or to meet the intent of the criterion has been taken and is reflected in the services provided. So that's just so we understand that from an auditing perspective, it's not going to be black and white, and we by no means think that the reviews are going to cover off that. But what it does try and raise up is that rather than expecting everybody to have a governance group with Māori representation, that actually there might be some other way that providers might describe that. Maria, did you have anything to add to that? Okay. So obviously you all will know we just wanted to look at auditing principles, and I'm not going to read out every part of this section, but you can. We want you to continue to use your judgment to determine the intent of the criterion is being followed. And your decision making should continue to be underpinned by the auditing principles. So just reminding ourselves of what those auditing principles are. Te Aparangi is not trying to set a bar that's any different, nor do we expect everybody to be. For example, when we talk about te reo Māori in provider inside of organisations, it doesn't mean we expect every person working in that provider to be fluent te reo Māori speakers. That would be unrealistic, but we would expect that somehow, and there are many ways for it to be achieved these days, that for instance, a provider could demonstrate that their staff have access to online learning, which often is free, and that can be accessed through places like Te Taurawhiri Reo Māori, which is a national database that provides, not only does it provide learning opportunities, and we'll send out some examples of these, but it actually provides resources that they can use specific to the organisations. And again, because often providers think that to do things Māori means to have to spend a lot of money contracting, etc. And might I add, we're not suggesting for 1 minute that we shouldn't pay for those contributions, that it's as important as paying for the infection control training that we pay for, or the health and safety training that we pay for, that we send our people away on. Then this is the same kind of logic, that sometimes we're going to have to contract people in to do this work for us, and we just want people to be able to evidence that. Ka pai. All good with you, Maria? Alrighty. Okay, if you need further direction, there are a number of places that you can go to determine the intent. And of course, the Ministry of Health themselves have many different documents, but also our DHBs often have great strategies. They have guidelines, action plans, frameworks, and every single provider will belong to a DHB. Those same DHBs will have a specific portfolio manager that the provider are working with, and that portfolio manager will have access and know of the Māori health team that work inside there, as well as the iwi partnership group that operates under that DHB. So what we talked about this morning is ensuring that that people understand there are many ways, as long as they reference the information, that they can actually get this information fairly easily. And there are some great examples. So we've just put a few there. He korowai oranga, whakamaua, which is the Māori Health Action Plan. So, often Māori, all providers are expected to demonstrate a Māori health plan. Well, they have different, frameworks that they can use there. Whaia te ao marama, which of course is the Māori Disability Action Plan. And if I just using the example of the DHB that I sit under, which is Waikato District Health Board, they have, for instance, the equity plan there, which is He Korowai Te Te Korowai Waiora, a great equity framework and really easy to use and implement inside the provider. So we certainly use it as a provider ourselves. And of course, in terms of the rest home and hospital that I own and operate, we use it there as well. So it's not recreating the wheel necessarily, but making sure people have good access to those things. All good, Maria? Come on. Okay. So let's start looking at what some of these things might look like. So the way this kind of goes is that we talk a bit about it and then Maria gives us some fantastic examples. No pressure, Maria. So let's look at 1.1 pai ora. And of course, here we've got, so you'll see the examples throughout the standards where we've got te reo Māori, te reo Pākehā. Pai ora is healthy futures. I know what it means for me. In terms of te tiriti, Māori flourish and thrive in an environment that enables good health and well-being. And as service providers, we work collaboratively to embrace, support and encourage a Māori worldview of health and provide high quality, equitable and effective services for Māori framed by te tiriti or Waitangi. So when we look down those criteria, and we're going to do each one. So Maria, what we might do rather this time, just change it up a little bit. If I go through the first one and you give the example, yeah, just like you did last time, but rather than read them all out, we'll do one at a time. So 1.1.1, my service provider shall embed and enact te tiriti or Waitangi within all its work, recognising Māori and supporting Māori in their aspirations, whatever they are, that is recognising mana motu hake. Kia ora, Maria.
So here with the providers, I talked about how we did it, how we would demonstrate that as a provider, and it actually flows down from 1.1 to 1.2, 1.3. So service delivery, what the evidence that you're looking for here is that the providers are thinking about what partnership looks like within their mainstream frameworks. So, for example, if we're talking about a mainstream provider who have predominantly provided service delivery based on the principles and vision of their organisation, what you would be looking for as an auditor is to see where they have incorporated the values and principles of the treaty into their vision and mission statements. Yeah, that's the first part. Shall we move to 1.1.2?
Yeah, there you go.
Yeah.
My service provider shall ensure my services are operating in ways that are culturally safe. Kia ora.
So the kōrero that we had with the providers is that if you're ensuring that 1.1 is done, that will flow down to 1.2, 1.1.2. So the evidence that you're looking for there is within the service delivery plan, how has the consumer been encouraged to participate in the formation of their service delivery plan, what I would be looking for is some sort of indication from the provider that we're acknowledging the whakapapa of that whānau member, of the consumer. Doesn't predominantly have to be Māori, but the principles would be acknowledging whakapapa, the whakapapa of the person that's interviewing them. That would be the service coordinator or whoever is coordinating that service delivery plan. Looking at ways that they can evidence that has happened within that context. If this is getting too complicated, just raise your hands and can they ask questions?
Yeah,
are they allowed or do they have to write them?
They're coming at the end, yeah.
Oh, they're coming at the end. Okay. So, you know, if that's too complicated, if my explanation is too complicated on what evidence you're looking for, write that and refer to that criterion, and I'll, by the time we get to the end, I should be able to explain it a bit better.
Ka pai,
Yeah?
Yeah, ka pai. Okay, so 1.1.3, my service provider shall actively recruit and retain a Māori health workforce across all organisational roles. And this is one we've had quite a bit of feedback from, isn't it, Maria? Because people are worried that we're trying to suggest that it has, you have to employ only Māori. So what's your thoughts about that?
So from a provider perspective, we would look to have a policy that addressed the recruitment of Māori, and so long as there is a policy there of acknowledgement of the Māori workforce and the intention of the provider to seek recruitment from Māori, that's evidence that they are addressing 1.1.3, noting that not all areas have in this abundance line of Māori who are trying to get into the health industry or the health workforce. And also we talked about providers having Māori sitting at different tiers of the organisation. I'm talking if you've got an organisation that has 3 tiers of commandment, your governance team, your ELT team, and then your management team. The expectation of 1.1.3 is that you would that the provider would actively look to be recruiting people for those positions. The criterion doesn't say that you have to employ them. What the criteria says is that you have to be acknowledging Māori participation and actively have it within your policies and procedures. Don't matter because they might not fit your criteria. If you've got one Māori and all these fabulous Asians, then of course you're going to go for the Asian. But the point is that, that's part of your recruitment process, and it says so.
Ka pai. And so from an auditing perspective, what we're really looking for our auditors to be mindful is that there is some way you can ascertain that from an equity point of view, because the workforce and recruitment and retention is often about that equity conversation. So that making sure that our providers understand what the intent is there and how do they demonstrate it. And as Maria said, there are many different ways to demonstrate that. So that probably answers 1.1.3, 1.1.4. And of course, as Maria said earlier this morning, if we're doing those first 4 properly, then the rest should just all flow down in the last part, which is the provider shall work in partnership with iwi Māori organisations. Now, we've given our providers a whole bunch of links, great ways to find that information about who are the local iwi in their rohe or in their area, who are the people that they could connect, how to find those contacts, because often it's about trying to just get to that place. If you don't know, you don't know. So we're trying to make sure that we do that for help assist with that. Ka pai? Alrighty. Okay. So how do we determine compliance for this? And again, we've kind of said about a couple of examples here that I know what it's means. So my service provider, I think we've just gone through those, and Maria's given us some great examples. And you might have some questions around what are specific concerns from an auditing perspective. Again, if you can email those through, send some questions, we absolutely will respond. Ka pai. So I think the key things to just remember, though, it's about how do we establish or how do you determine that there is a te tiriti focus or framework inside the organisation. How do they demonstrate that cultural safety for all people? Remembering culture is just not about ethnicity. Actively recruiting and retention of Māori health workforce. We know that from an equity perspective, this will actively improve the outlook for Māori people, because often it's about employment, education and opportunities, and of course recruiting into your workforce means that that's exactly what we're trying to do. Māori centered doesn't, we understand that not everybody is Māori, but often a Māori worldview is a worldview that's amazing, that's a pretty awesome worldview for everybody. So there's that, and of course work in partnership with iwi and Māori organisations. Ka pai. So the answers we have described to our providers were largely in the sector guidance on the ministry's website, and we wanted to take them back through to that, because often when people see the criteria, they can feel a little bit a little bit shocked by it. From time to time, we've had some feedback over, well, since we've taken this stance inside Ngā Paerewa, but we always try and refer them back to the ministry's website to get that guidance if they're having trouble trying to figure that out. And of course, we would hope that all of our auditors do the same, just for consistency. Okay, within 1.1 Paiora, Ngā Paerewa, which is criteria 1.1.3, is new to the user. So we're going to try and look at some of those examples now. Okay, my service provider shall actively recruit and retain. We talked about this. What are some examples you might look for? And I think Maria, actually, sorry, I think we're repeating that because we've just done that piece, haven't we, Jade? Yeah, ka pai. I think that was more a reminder for us. Some other ideas, though, are for establishing those links. We've got Te Rauora listed there as a really good reference point. Many people don't know about Te Rauora, and they have a whole bunch of evidence of initiatives undertaken and directed by Māori Research on how to increase the Māori health workforce. Recruitment processes, Te Arawhiti's capability framework is available for people, and we want them to do that. So we want them to establish and maintain links with Māori stakeholders within their rohe, demonstrating consultation with iwi hapu whānau and Māori communities who have links within this service. And again, that's helping our providers to find those links, and evaluating recommendations and level of satisfaction within service delivery by Māori users. So getting good feedback about what Māori users. Now, some of the feedback we've had already is that people, many organisations won't have Māori inside their facilities or their service, which is, we can completely understand that in some parts of the country. However, we're still asking that everybody operates as if you would have somebody there, and if you do so, because of course the treaty is that kind of foundation document for all of us, then there's an expectation as to how you might describe that partnership. Maria, did you have anything to add to that?
I think the key to all of this for the providers when we were talking to them is them understanding that these standards are now asking them to demonstrate and evidence what partnership with Māori looks like, and that can be reflected either in what they are doing in service delivery, policies and procedures, and just within their office. If you're an auditor and you walk in there and their greetings are in English and in Te Reo, that's evidence from my perspective that, hey, these people are trying to demonstrate what partnership would look like. Yeah.
Ka pai. Kia ora. All righty. And we've given a bit of a backdrop there for Te Arawhiti, the Office for Māori Crown Relations capability framework also provides good steps that an organisation can be adapted and used by service providers to recruit and retain Māori staff. So again, this gives some really good ideas as to how to go about that, and it helps providers to really assess where they might sit in terms of the way that they recruit, the way that, the places they might go to add those recruitment if you were trying to recruit more Māori into your workforce, where might you go to advertise, for instance, or where might you, or are there other places that might, you might have locally that are that could be of help in this area? So that's te arawhiti. Ka pai. And of course, one of the things about advertising that we know is that the use of te reo Māori, like Maria said, can really enhance the uptake of people applying. If people feel like the job that's been advertised is something that they can relate to by the use of language, stating the importance of te ao Māori and other relevant knowledge inside of those criteria that they might be looking for, use of Māori recruitment agencies, there are many of them, and Māori publications and media, and we've given some examples there, share vacancies directly with Māori groups and networks, and again, there are many of those, Indigenous consultation networks that actually put their advertisements out everywhere, and consider other non-standard recruitment approaches. So I know that one provider, for instance, that I work with, they have what they call, rather than interviewing individually, because individual employment interviews often go very poorly for some people, they'll have what they call a wānanga interview, and they invite all the applicants at once to be involved in this wānanga, and they ask general questions, they set activities, and they get everybody to respond, and everybody listens to each other's responses, and at the end of it, the employer makes a choice about which of those contenders they thought was the best based on that. And of course, everybody's been present, so it's very transparent. They've heard what other people have to say, and often the feedback, when they've gone back to sort of give them feedback, has been from the applicants that weren't successful, was, oh, that was a great way they answered that question. I'm going to remember that for the next time I get interviewed. So, that's one of the strategies that you might use in a te ao Māori framework. Maria, did you have anything else to add?
No, kei te pai. Awesome.
There you go, and of course, the old adage, which is that that in there, when you're looking at this and checking as an auditor about how that might have been achieved, that people were able to bring their support people, that you applied tikanga, so it might be as simple as karakia at the beginning of the interview, and seek representatives from Māori communities nearby who might help you give a different perspective. So it's an adding to, not taking anything away from. Ka pai. All right, 2.3, whakahaerenga ratonga service management. So another example here of 2.3.6, service providers shall establish environments that are encourage collecting and sharing of high quality Māori health information. So what we described there is service providers, encourage healthcare and support workers at individual and team levels to participate in learning opportunities that provide them with the most recent literature on Māori health outcomes and disparities, health equity and quality, and enable them to use this evidence to learn with their peers. For example, you can see the website for Māori Health Review. Jade, did you want to go there and have a look at that, or are we just going to assume that people can go and look? Yeah, ka pai. And of course, support the development of expertise in te reo Māori for all healthcare and support workers. So again, often people will say that they can't do the teaching of te reo Māori to their staff, and actually there are many online opportunities which are free, where very basic things. So it's really just about what are those key mihi. More and more, Aotearoa looks very much like a multilingual country as we start to, progress ourselves, and and it's really evident in the fact that 9 times out of 10 I hear whānau being used before I hear families. I hear kia ora, and of course our national airline makes sure that we know, about kia ora and so on and so forth. So we're seeing the language used a lot more. These standards are not saying that we expect everybody to be, mātanga reo or, the top of the top reo speaking people, but there is a endeavour made to ensure that as one of the 3 official languages of this country, that we give opportunity in the same way that we teach people about infection control, that we teach them about language and the use of language at a very base level. And that can be as simple as teaching the vowels so that pronunciation of names is said correctly. And that's not just pronunciation of the names of residents, but acknowledging the places that they live in. For instance, we have many residents in our rest home who live in a place called Harataunga, but often it's referred to as Harataunga. So it's a really good opportunity to help people understand that for those Māori whānau from that village, it's very much a part of their whakapapa. It's very much a part of their identity. So being able to say those words by understanding the vowel systems is a really good way to achieve that. So that's what we're looking for inside of there, and supporting healthcare support workers to build their own knowledge. This is, and Maria used a really great example in our morning session of how we share whakapapa. And whakapapa is that genealogy link, and everybody has one, no matter what ethnicity, no matter what culture, everybody has genealogy. So it's really about stepping out how our healthcare workforce can use that to connect to people. And again, they've got a framework for health literacy that we've referred to there, and service providers given healthcare and support workers the opportunity to reflect on their own cultural assumptions about Māori and how these might influence or bias the way that they interact with them. Maria, did you have something to add there? Oh, ka pai you. Okay. Alrighty, context and intent can also be gleaned from the tripart outcome statements. So again, we've tried to provide it, both languages there as well, that I know what it means, and so we've looked at it from the people, te tiriti, and as service providers. So, you know, the people they want skilled, caring healthcare and support workers that listen to them, provide personalised care and treat them as a whole person. Te tiriti is the delivery of high quality healthcare that is culturally responsible to the needs and aspirations of Māori is achieved through the use of health equity and quality improvement tools. And as service providers, we ensure our day-to-day operation is managed to deliver effective person-centred and whānau-centred services. So we can see that we're all trying to achieve the same thing. It might be just through a different lens. And for our expectation from an auditing and from a provider perspective is that people are able to articulate what it means for them. All good, Maria? Okay.
All good.
2.3, whakahaerenga ratonga service management. And again, this is 2.3.6. Is it just that? Did we just do this one? Or yeah, I think we did, didn't we? Sorry, we might be going backward a bit there. Apologies, folks. Okay. So just to enter on, this is just one example of the many ways we can engage around te reo Māori. And I think we've mentioned it here in this presentation too, because often again, you give feedback about how people might be able to engage and support this. So if it's not clearly evidenced and you decide that this might be something that's a partial attainment or has a corrective action aligned to it, it's really good to be able to say, and there's just so many places that you can actually get, support around te reo Māori. These are them, just as an example. And as I said, Te Taurawhiri Reo Māori, which is online, and you can go and get some really good resources there. And I will make sure that I send Jade the link there so that we can put up those examples, because I wanted to share my screen, but I don't know if we can do that really effectively with this many people. Do you think I could? Yeah.
Possibly, yeah. If you still control.
No, it's all good. We'll leave it for later, but I will make sure that when we put these up, those links are there, because it was really just to reinforce the ability to go onto those websites and not only get frameworks for language learning and plans, so organisational plans. So it has this beautiful assessment that you can do about where te reo Māori is within the organisation. It then has this lovely framework that you can then, based on the assessment, put a plan in place. And I thought that would be super useful for providers. Okay. Oh, and more reo Māori. So there you go. There's just so many different ways that we can get it. And that and even down to a pepeha, which is a really lovely way to be able to provide an example of reo Māori support. Okay, one of the key things the 2021 standard is asking for is greater evidence that service providers are developing or strengthening and maintaining relationships with Māori. So this is tangata whenua. So in the current standards, tangata whenua are consulted in order to meet the needs of Māori consumers, but in the updated standards we talk about governance bodies shall have meaningful Māori representation on relevant organisational boards, and these representatives shall have substantive input into organisational operational policies. Now, sometimes people might have Māori representation, but they might not be, that representation might not be involved in those more meaningful activities that set the pace for a provider. And we're asking that the evidence, look for evidence that service providers are forming these relationships or are connecting with local mana whenua of their region. And we've given our providers today, and there were over 100 of them, so that was awesome, examples of where to go, like Māori maps, and then of course there is also I've just lost the te whata. That's right, so te whata, which is another way that they can find out Māori data, they can find out their local iwi, and of course that gives them better ways to strengthen that. So yeah, so that's kind of what we're looking for, the difference there. So one is being very specific, and you know, and asking the question that we have substantial input not only into the governance but into those organisational operational policies. Ka pai, Maria?
Ka pai, ka pai.
All right. So question for the audience: what evidence might you look for that could demonstrate a small ARC provider, so we're talking about a 15-bed, has established relationships with local mana whenua, iwi or Māori communities? And then there is, how might this evidence be different from what you might expect from a large ARC provider with, let's say, over 15 premises across the country? So that's a pātai for the crowd. Jade, are we asking for that feedback like straight away, or are we accepting people are emailing that feedback in?
People can talk if they would like in this one, because there are only 48 attendees this time. Yeah.
Ka pai. So there you go. Anyone want to have a go at that?
Are they there?
All right, it looks like we might have some reluctant audience participation today. Anyone? Yeah.
If you
okay,
think...
I'm no longer muted, so can you hear me?
Yes, we can. Kia ora.
Kia ora. Yeah, I think people are muted and they have to press *6 to come to speak to you. On the whole, basically, I actually find from auditing that the smaller providers actually have a much closer link to Māori, iwi and services within their community than the larger conglomerates. I don't know how other auditors find that, but I think this is more personal in smaller towns and country areas. They do tend to, even in the, you know, South Otago region, they do tend to have links, maybe even as far as Dunedin, but they still have them. And so I don't think this is going to be a problem, but I'd like to hear others' views. Hello, are we still connected?
Yep. Yes, we are. Sorry.
Kia ora, Maria. It's Judith Morgan here.
Kia ora, Judith. I'm great, thank you.
For the larger providers, they're going to have to collaborate with different iwi from across the country rather than just one.
Yeah, that's a great point.
I'd agree with that too, Judith.
Yes, and we used the example with our providers this morning that, for example, like as a provider network and here in Hauraki, we have 3 different district health boards that we and 12 different iwi that span the width of our community. And so you're right, there are going to be times when when people are expected to reach across different providers, different iwi groupings. I think, though, it's not necessarily saying that you have to do all of them, but there needs to be real evidence that that there is that engagement and the opportunity for those worldviews to be played out in whichever way.
Kia ora, Rihanna, it's Kathy Cummings here.
Kia ora, Kathy.
Kia ora. I was just thinking about your partai there, and would the difference also be that the levels within a larger, more complex organisation at which that engagement occurs might be different? So, for example, if we've got the multi-site, what we might call the corporate aged care providers, then you might look to see that that engagement is happening sort of at governance and senior executive level, whereas the smaller, more community-based services, that might look a wee bit different. Just my thoughts.
Yes, yeah, good points, Kathy. And I certainly think there's no, by the way, whānau, there is no right or wrong answer for this. We were just really interested to find out what people thought when looking at it, those kind of perspectives that might be very different, and what you might expect to see between smaller and larger groups.
So I was just going to jump in there, Rihanna. It's important that our providers don't go into this thinking it's this big, because in actual fact it's really this big. Because if we're talking small providers and evidence that we would look for as auditors, even if, say, let's take for instance this 15 bed, when someone dies in that facility, even calling the local kaumātua to come in and do a blessing in that room is evidence that they have a relationship with the Māori community. So, and that's this big. It's not, hey, is the organisation, is the provider sitting on the iwi's trust board? It's not that big. It's the size that demonstrates that you have a relationship with the Māori in the community, and it's that big. Yeah, does that? I'm hoping that's helpful to the auditors in terms of what they're going to be looking for in terms of evidence. I think you do it already, though. Is the other thing. You already look for evidence within your audit processes of relationships with the Māori community, and you ask them, hey Judith. Ka pai, Liana?
Yeah, ka pai. Kia ora, Maria. Love working with you. Okay, shall we move along? Yep, ka pai. Ah, cool. Excellent. Plenty of total. Well, that's great. Okay. So just to remember that this is a moving feast and an evolving space that will grow and develop. It took many years to review these standards, and it felt like it was a big job for those who, there were plenty of people involved in the review of them. We're all learning and the refreshed requirements of Ngā Paerewa Health and Disability Service Standards together. And we've been, so from Te Aparangi's point of view, obviously there were lots of things that that people pointed out about Te Tiriti and so on and so forth. So our commitment is to make sure that we keep keep giving these sessions, that we create an electronic learning tool, which we are completely committed to. We've just got to find the right group to establish that, which is why we're doing these kind of things now. The Ministry of Health are committed to a non-punitive approach of transitioning to the new standard, so that's really helpful as well. There will be grace periods for partially mapped and unmapped new criteria. And it, again, yeah, it really is trying to learn together to make sure that what we come out with is some really meaningful, you know, standards that help to direct the way that we provide good service for everybody in a really te tiriti partnership kind of way. So we're going to question time. Maybe I pushed one too far. Now, is it the same thing again, Jade? You'll read out any questions, or are we just having real-time questions?
We'll do real time only because we haven't received too many in the chat yet that I can see. So okay. Perhaps we'll just 4 minutes for questions. Yeah.
Do you have the questions from this morning, Jade? Maybe if we share some of those questions, it'll give more people are thinking of things.
Yeah. So one of those questions was, can you see what iwi or hapu have influence over an area? I can find the nearest marae, but not with whom to collaborate or consult in relation to Māori maps.
Yeah, that's right. So so Māori maps will only give you so much information, and then our encouragement to the providers was to they're going to have to get down to the local level and find out who their local iwi are. So we're giving them ways to find out who that local iwi are, and then we expect them to go and find. In the same way, if I can use the example, in the same way that for instance, here in Coromandel, we don't have an infection prevention agency on site. So I have to go and I have to Google things and I have to find out who those different providers are. And then I have to ring around and engage with them, see which one I like, which one I don't. And that's how we kind of establish who we're going to use. And it's the same properties in terms of this. So, you know, making sure we get out there and find those answers. Any other key ones? Well, oh, sorry, Kathy's got a question. Can you give us an update on the pilot audits? I can't myself, Kathy, but I understand that there have been some done. Is that right, Jade?
They are in the process of still being planned, I guess. I probably isn't a question for this forum, but I can say that they have been impacted by the current alert level 4. So best to direct that question to certification at health.govt.nz or Christine Marsters. If you have her email, certification inbox can also give her contact details as well.
Have you got another one there? Because
Yes, I do. So can agree with doing whakapapa with identified Māori. However, difficult to do when NASC have not identified. How do we get more consistency, I wonder?
Okay. So when they say NASC haven't identified, what do
the needs assessment.
Right. Okay. So they're not asking for. Okay. Yeah. So probably we do have to get some consistency around that, because we talked about in our morning session that one of the great ways of getting to know people, you know, as part of an assessment, for instance, might be that you look at the whakapapa kind of, so anyone who's ever done a pepeha, for instance, will understand how we identify whakapapa. So for Māori, it's kind of like we look to our maunga, you know, so I'd say koriana manual tōku ingoa, ko moihau te maunga, ko tikapa te moana, ko hauraki te whenua, te hei mauri ora, and then I might go on and say who my parents are, and so on and so forth. But straight away when I say that, people will go, moihau, that's in the Hauraki region. Tikapa, yep. Now we know that this lady is from Hauraki or from the Coromandel Peninsula. So I get, you know, when we're talking about whakapapa, and we actually mentioned delving down. So if you're asking ethnicity, perhaps it's good to ask also what their iwi affiliations are. Now, normally, even at NASC level, they should be collecting that information. because usually we do have it. So right down to these days, COVID at the moment, when we take people's information, we're asking if they're we ask them to self-identify what their ethnicity is. If they identify as Māori, we then go on to ask them, and what is your iwi affiliation? So, and that can be helpful from the point of view of a provider, that then now you have a way to go, okay, so this person is, here, but they actually whakapapa back to, in our case, Ngāti Maniapoto, or down to where Maria is. And that's a long way from where Coromandel is, for instance. So those are some of the examples of using whakapapa that can help to enhance the way you might have service delivery happen. And it's a virtual world, so it's not like you can't do things across, in a virtual way, rather, to connect people back to their whakapapa. And an example I have is that I've got one patient whose family come from Whakatohea. They are living up here in the Hauraki region, and so they have karakia down there. They have ringatu karakia often. So we're able to virtually connect them into that so that they can go and enjoy karakia with their whānau, but obviously not be there. So that's just an example, and certainly, hoping people will think outside the box. Jade, how about you? Maria, do you want to take this next question?
Oh, what does it say?
Jade's gone.
Well, we've reached our time. So we might close and perhaps we'll look to answer the questions in another fashion, certainly, but keep sending them through.
Hey, I just wanted to agree with what Colin's just put down there.
I agree.
Baby, Nest.
Yeah, that's a great suggestion, Colin.
Yeah, ka pai.
Oh, that's awesome. Yeah, no, and this is why feedback is so good, because that's a great example of probably a loop that we haven't brought in. So yeah, definitely, we will offer it up to NASC and do it. I'm pretty much willing to have a chat with anybody that wants to know more about what motivated this thinking, take responsibility for, I suppose. So we are at the end, folks, aroha mai. But these slides, we just had a few extra slides here, which was the Woya Next. Ngā Paerewa,
we can carry on.
Yeah, I thought it was for till 3. But
I apologize.
No, that's okay. So we're nearly finished, folks, anyway, because if you got excited by being let off the hook, we'll just finish out the rest of these slides and then you can all be released. Okay, so the where to next, Ngā Paerewa Health and Disability Service Standards. So you can see the timeline there. And where are we at the moment? So we're doing the online workshops. So true to word, we're right there at the moment, lunchtime sessions. The piloting is due to begin about now, but as Jade said, there is going to be some issues around the COVID lockdown and how we manage that. September, we'll see us start doing some targeted sessions and conferences. And again, this might be a little bit slow in terms of getting it up and running, just based on what we might find out at 3 o'clock this afternoon. And of course, targeted workshops based on feedback. So we really want to be responding to feedback. And so that's important. Because I think one of the things that we all let ourselves down on with the last set of standards is that it took too long to review it. And that means that we weren't getting other than what we were doing each and every year by auditing and giving feedback on it, we never actually reviewed the standards to see that they were fit for purpose. And I think the timeline for a review was about 20 years, wasn't it, Jade? From implementation of the first standards to review. So too long to review, which is why we're intending to really look at this all the time and ask ourselves, actually, based on the feedback we're getting from auditors, from providers, and those NASCs now, we'll fit that in. In fact, any organisation, what can we change up or what do we need to do? Yep. Yes, James, the presentation will be, I don't know if we were going to email it, but we were going to put it on the website, weren't we, Jade? So that you can have access to it. Or, yeah, if that's helpful. Is that correct?
Yes.
Okay. And of course, developing the online e-learning module, because that was one of the things that we also committed to. amend the sector guidance following the pilot and DAA handbook currently being updated as we speak. Oh, and there we go. We reached the end without even knowing it.
Sorry, Liana, I realize I've got confused because in the corner the timer says an hour and a half, but we have only been going for an hour. It's clearly Friday. So we do have some more questions if we want to go through those for the last 25 minutes, if we want to, or gift of time. I'll let the host slash if perhaps comments decide.
Yeah.
What do you think? Shall we go ahead and answer some more questions?
Yeah. Oh, yes, sorry.
Perfect.
I thought we were waiting. Yeah.
Oh, perfect. All right. So, kia ora. How can we look at Māori data sovereignty when we look at technology, digital solutions, cloud solutions, guidance and process to engage with iwi and wider partnership groups? Oh, that looks like two questions. Well, data sovereignty.
Yeah, I was going to say. So Māori data sovereignty has become a really big kaupapa at the moment, and part of the iwi Leaders Forum, which is like a national consortium of all the iwi leaders, has been to establish a group who look at exactly that, which is Māori data sovereignty. The recent census tells us about why this is important, of course, because the return of data, particularly Māori data, was so poor, it really didn't stand up to scrutiny around those kind of national statistics. And they have gone through and cleaned it up somewhat, so you will be able to find the data. You will be able to find the census data has been released now, but it has taken a lot of work and partnership with the Iwi Leaders Forum to get that going. But Te Whata was part of that. That was part of the solution, was to create a website. Now, can we actually show that, Jade? Can you bring that one up? So I'll just give an example. And I don't know whether this is answering your question adequately, but I wanted to, we shared this with the providers because we believe that data sovereignty is a big part of it. Okay, so here we go.
Oh, sorry, wrong one.
That's all right. You're good. You've got it up in the chat box, so that's awesome.
Here we go.
Yeah, that's right. Yeah, so this is the, if we go into, oh gosh, should we go into your region, Ewa? Maria, we'll go, look, we looked at mine before, so let's go to the Bay of Plenty, shall we?
Yep.
Will Bay of Plenty do it for you? Which one would you like out of these?
Have you got Ngāti Awa there? I'll be really biased.
Yep. I know, I did it too, so that's okay. Okay, so if you go to Te Whata and you look up Ngāti Awa, then it's going to have this dashboard that you come across, which first of all tells us the estimated population there affiliated to Ngāti Awa, and that's as of 2018. So Te Whata has updated they've used the census data to update this information already. And Kiri Kōwhai Mikaere is the leading statistician on this piece of work. And so there you go, you get a population glance, the highest qualifications at tertiary level in 2018, the housing tenure. So can you just open up the housing tenure for instance? There you go. So straight away you'll get a little graph that shows you those who own their own home. Now, if you do a comparison with all Māori, then it will show you, so you can see that the data locally is very comparative with that data against all Māori. So what that tells us that Māori throughout most of Aotearoa, about 30% of us own our own home. Yeah, and that's, so Ngāti Awa is right in there with the national statistics, basically. So if you go to health on that, so again, smoking, the health information is very limited as it comes down. So it tells us how many smokers, for instance. We can do a comparison with all of Māori and then all of New Zealand, which gives you a great little graph that gives you that information as well. Kapai. And there's other bits and pieces. If you go to education in there, again, it'll give you your, adult qualifications, and you can do those same comparisons. So, yeah, so the idea here, we can jump out of there. We've put the link on the chat engine there. The idea of te whata is really to be able to ascertain what that data looks like, the richness of it, and of course to note the importance of it. So data sovereignty, making sure that we adhere to those same principles, that treaty principles, to make sure the data sovereignty is maintained, and use good resources to be able to back that up. Now, what was the second part of the question? Sorry, Jade, I forgot.
Oh, no worries. It was sort of two different questions. Guidance and processes to engage with iwi and wider partnership groups, but that sounds more like a statement.
Yeah, that's right. So, well, perhaps that is a. So one of the things that, again, we talk to the providers about is how do they do that? If you've never had engagement with iwi or hapu, or even whānau for that matter, what we're suggesting is someone inside that organisation, whether it be kaimahi, whether it be the residents themselves, the whānau of those residents and all that kaimahi, will be able to grow out a knowledge base, if you like, by seeking out who are the local iwi in those areas. We're hoping that if you can find that information, that you'll be able to then start, describing how those relationships happen for you. And I mean, again, another great example is that most of us have a portfolio manager who we report to as part of our relationship with the district health board. So it's no different. Having a relationship with iwi is a lot like that. It's about, it's a really good thing to have. It's a positive. It's an and conversation. It's not taking anything away from anybody. Just adding to the value of those relationships. And it's many of the providers will be really surprised that when they get those relationships going, how beneficial it is for over a range of things, whether it's training, whether it's local knowledge, telling stories about the place names. So for instance, here in Coromandel, it's Coromandel Town, but it's also known as Kapanga and Waio, and those names go back to the landmarks and the rivers that run through them. And so just this basic information can really enhance the way a provider thinks about what they're trying to do, who they're trying to engage with, and the importance of knowing their local environment.
All right, next patai. How do we address patients' needs if they don't identify as Māori on our admission form? Should we add iwi as a question? Oh.
Yeah, and so that's a really cool question. Maria, you jump in anytime you're ready. One of the things that I'm really mindful of, that because of our rich history, and New Zealand has a very, very, very complex but rich history. No matter which way you look at it, no matter which side of the whether you're Māori or non-Māori, that history, that relationship has had an effect about how we identify as people. So for instance, my nanny and grandfather, they were fluent speakers of te reo Māori, but they knew that to teach their children te reo Māori was going to subject them to, back then we called it corporal punishment, straps and punishment, basically. And so they made an active decision not to teach their children te reo Māori. And all the way through to us as grandchildren, it was really interesting because we'd always hear them speaking in te reo Māori together to hide what they were trying to talk about us, without us. But then when they spoke with us, they would, be very, very clear. Oh no, only te reo Pākehā, babe, don't do that. Now that meant that a whole generation in our village is without the language. That's our parents. And what that meant for us, the next generation down, for some of us, we went back and we reclaimed the language. And of course, we reclaimed it so we could teach our children. So the rule of thumb around language acquisition is that it's like one generation to lose a language, and like 5 generations to keep that language safe again. So that's me, and now that's my children and my grandchildren. We're 3 generations deep into language reclamation. But I'm really mindful that I want to make sure that my great-grandchildren and every mokopuna after that has language acquisition. So I think that's one of the things that when people don't identify as Māori, it's because something's happened. There's been a disconnect. They've moved from out of area. They've gone into the urban drift during those formative 50s, 60s, 70s. They may have been in state care. There are lots of reasons that sit behind a person saying, actually, I don't identify as Māori. And some of that, unfortunately, is because I don't like to be acknowledged as Māori. I know for my husband, he's very dark. He was often called Blackie. He was often called other such names. And so for him, it was really challenging to say he was Māori. But as we've reclaimed, we understand now that actually there's nothing wrong with what we are, of what we've been through in our past, of who we are as a people, and we've learnt to reclaim it. But that's not everyone's journey. So I agree, having multiple ways. And one of the things we do is that if you don't identify as Māori, but then you might ask the iwi question, you would say, and we might say to them, you're not Māori, but has anyone else in your family had connections to different iwi or hapu? And they'll go, oh yeah, my grandmother was of Ngāti Awa descent. And we'll be like, oh, ka pai, excellent. So now we know that there's a connection, that from an ethnicity point of view, you are connected. And it's not to push it on anybody. That's a data collection function, I've got to say. But yeah, that's just one example. Sorry, long-winded. There you go, Maria.
No, that was great. But I just want to, I want to say that what Rihanna is talking about is why it is so important for providers of any health service to implement in some form or another Treaty of Waitangi training. Because if it's a good Treaty of Waitangi training, it will talk about what Rihanna has just talked about. It will talk about other things that have contributed to the reason why people don't identify themselves as Māori. It will talk about, these are good treaty sessions, it will talk about the Tohunga Suppression Act and how that impacted on our Māori communities. And, it's really, I think, as part of our auditing services, if we look to see that they have evidence that they have got Treaty of Waitangi training within their curriculum for all of their staff, then we're moving with a provider that has true intentions in partnership with Māori. Yes?
Yes, sister. Love it. Okay.
Next.
Anything else? We might have to finish up there, because by the time we do karakia, I'm just mindful, karakia and any closing comments.
Yeah.
We might be or do you want us to do one more, Jade? Because you're looking.
I reckon you could probably do one
Go on,
more,
then.
possibly.
You're the boss.
Let's see. Does the hospital's korero mai, I think this is Waitemata's, process meet these needs regarding complaints? Also, this was about the complaints question. Do you know about the korero mai? All right, we will.
Hang on a minute.
I read that question, but I didn't know anything about the korero mai. Is that a complaints process?
Yeah, like it's using, I think it's the Waitemata, is that right, Jade?
Mm.
And it's using, korero mai, talk to me. This is that, I think it's like I3 Institute for Innovation Improvement. I think that's what is that what we're talking about, whānau? The Talk to Me co-design. It's a co-design of patient, family, whānau-led escalation system for deteriorating patients at Waitemata. I think that's what it is. Oh, there you go. Jade's already put it up. Too clever. Much faster than me as well. Yeah, so this is another great example of, of a bit of innovation, I suppose, and acknowledgement of a lot of the complaints. So I think it was 42% of the complaints referencing communication problems in New Zealand. And overseas models cite that most common reason for a patient, family, whānau-led escalation are due to breakdowns with communication. So I think that's what that's a really great example.
Perfect.
Yeah.
And I think there was another question. I think we may have missed medications 3.4 though. Would be good to have some guidance from a Māori perspective on this, which perhaps is a bit too big of a question for now.
Which one was the, sorry?
It was around medication management, I think, 3.4.
Yeah, would it be helpful if I got the slide up, or shall we just say
Can we
it?
just have a quick look at it?
Can we have a look at it? Yeah.
Yes.
Before Auntie comes on TV
Yes.
tells us.
All right.
Tells us what's the what.
Yep.
What's what.
I think it was, oh, can't remember. Shrink.
There we go.
Oh, back. Aku rongoa. My medication. So 3.4, service providers shall identify cases in which there are difficulties accessing medication and support people to access it. Service providers support Māori and whānau to access medication, shall provide appropriate support, advice, treatment for Māori. Service providers work in partnership with Māori to verify that the appropriate support is in place, advice is timely, easily accessed, treatment is prioritised to achieve better outcomes. As a kaupapa Māori provider, one of the things that we constantly have trouble with is that we have GP practices as part of our organisation. And of course, because we have like a very low cost access fees or no fees operation, then people will come in and get the assessments done and, you know, see their GP, see their nurse practitioner, and then of course they won't have enough money for medication, and therefore they will not go and pick up, or they'll pick and choose which ones they pick up depending on how much they can afford, because there is a threshold you have to meet before you get the subsidised medications. So what we've kind of taken to doing as a provider is paying for all of those medications, making sure that access is not the barrier. So in other words, if you're going to come and see our GPs, then we certainly want you to be able to access the medication and the support that is readily available. And of course, we also have a home-based support services as well. So one of the things there too is that we can organise blister packing, and we can make sure that we've got medication oversight by a registered nurse who can go into the home and make sure that they're taking their medication at appropriate time. Because what we recognise is that health literacy isn't always you know, that a lot of our Māori whānau don't have good health literacy. They may not understand or have been given explanation about their medication. And so what we recognise as a kaupapa Māori provider is that's something we have to apply ourselves to, so that A, people use their medication right, B, they know not to share it around with all their friends and whānau. And trust me, when it comes to gout medication, that's a very common problem. And of course that they're accessing, you know, good advice regularly, and getting the actual medication in their little hot hands. And if they're having trouble administering it, that they get that as well. Yeah. Maria, did you want to add anything to that? Or?
Just that in the standards, we need to, as auditors, we need to recognise that rongoa Māori is seen as a form of medication for our people, and often they will use that instead of or alongside of. So yeah, that's just a note to ourselves.
Yes, that's
an
right.
acceptable medication, form of medication for our people.
That's right. Yep. Ka pai. Yes, and we really have reached the threshold now, Jade. Thank you for that last question. Whānau, before we finish, we are going to finish with karakia, but on behalf of myself, Maria and Jade, ka tuku tēnei mihi kia koutou mō tō taimai, mō tō whakarongo. Just saying thank you very much for coming. Thank you for listening. We hope it's been useful. We understand that this is just a beginning. So this is not, you know, one size fits all and it solves all the problems, not at all. And we really love feedback. So if you can give us feedback on whether you found it to be useful, and we don't you know, we've got thick skin. So happy to know whether it wasn't and what you'd rather hear about, because we plan to keep on doing these things as we go. Obviously not every week or anything, but certainly, you know, we want to be doing it at least 2 or 3 times of a year so that we can get some good feedback from everybody. And watch out for the electronic training modules. We're excited to get those up and going as well. So on that note, ka nui te mihi kia koutou. Please stay safe out there wherever you are in this big old network of ours. Take care of your families. Stay out of the way of the Delta variant, and of course, enjoy Auntie Cindy's presentation very shortly. We're all looking forward to it. So on that note, whānau, ka nui te mihi kia koutou, ka tuku tō tātou karakia whakamutunga. Whaia, whaia, whaia. Ngā uruatanga o te manatū haora, ko te manaaki, ko te kaitiakitanga, ko te whakapono, ko te kōkiri ngātahi, kia tai atu tātou ki pai tata, ki pai tāwhiti, ki pai ora, kia tūturu, kia whakamaua, kia tīna, tīna. Haumie, huie, taiki e. Ka ki te whānau.